An important step when preparing to send blood work out to an outside lab for evaluation is making sure that the submission form is filled out thoroughly and accurately. We want a full patient signalment with the client name, the breed, species, age, and also the veterinarian and the internal identification number. At this point, we would also check which blood work we are running and make sure that we have the appropriate samples before sending it out to the lab, just so we can get back the correct results as quickly as possible, and that there aren't any delays for inadequate sample amount or not sending in the correct tubes. We also want to put a full patient history because this can give the laboratory technician or veterinarian some insight into the case in case there are some results that might correlate with the physical exam history. The next step to take before submitting blood to an outside lab is to spin down your serum separator tube. This was sitting for at least 20 minutes before spinning, and the clot is nice and separated from the tube. I'm going to put it in the centrifuge and then grab an appropriately filled balance tube and place them so they're nice and even in the centrifuge. I'm going to close my door. I have it set to the 3300 RPMs, and I'm going to spin it for 10 minutes. And then I will collect the sample once it's done. Now that I have all my lab samples, I'm going to get it ready to submit to the lab. I have my lab form with all my information filled out, and that is going to go in the outer pocket just so it's not potentially contaminated by any of the lab samples, and that will give them easy access to the form. I'm then going to put my blood tubes as well as my urine tubes into the bag, seal it, and then this whole bag will go into the refrigerator to wait for the pickup from the reference lab. I'm now going to submit a biopsy sample for shipment to an outside lab. I have my biopsy jar here with my sample inside. It contains a 10% buffered formalin. I'm going to make sure that's nice and tight. The jar itself is labeled with the date, the doctor, the patient name, and the specimen. This is going to go into a secondary container that I have available that is also labeled with the patient name. First, I'm going to wrap an absorbent material around the biopsy jar that will also provide some padding for the specimen, and close that. I'm going to tape the secondary container just in case there's any leakage, just to provide a good seal around that. I'm then going to put that sample into a Ziploc bag, which will just provide another layer of protection during shipping. And then wrap the specimen in an absorbent pad, which will once again prevent any spread of possible leaked formalin, as well as provide some extra padding. I also have my biopsy form for the lab that this is going to. I have the patient information and the information on the sample. This is going to go in its own separate bag so that if there is any leaking of the formalin, it does not mess up the form, and they can still get the information that they need from the veterinarian. I'm then going to wrap this in some bubble wrap, put that into my shipping container with my form in its bag on the inside. On the top, so that when they open it, the form is right there and they know the sample that they're handling. I then, to go on the outside of the box, have a shipper's declaration for the substance that's inside the box, so they'll be alerted that it is a biopsy sample with formalin. And I have my FedEx label with the address for the lab, so that the biopsy sample goes to the appropriate location. This is our IDEX ProCite DX CBC analyzer. We have our main CBC component here with our vet lab station, which can be hooked up to multiple IDEX lab equipment to run, different chemistry analysis and other tests. We have our solution there, test solution, and I'm going to show you the monthly cleaning, maintenance, and quality controls on this machine. Part of our monthly maintenance is flushing the machine with a 5% bleach solution. I have my bleach that does not contain any additives. It is a 6%, so I do have to dilute it out with some distilled water to make our 5% solution. So I'm going to go into our instruments menu and go to our ProCite, and then go to our diagnostics menu, click on the monthly rinse, hit the monthly rinse cycle, and it alerts me that it will take 25 minutes, so I have to make sure this is done at a time where the machine is not needed. So we have a 5% bleach solution ready that's going to go into our machine, and I'll hit the start button. And then the machine over here will begin to give me the status of the rinse. So the machine has taken up the bleach solution, and it's going to use that to internally clean out the components. It tells me that it's busy on our screen, and it will begin to show a little indicator bar with percentages showing its progress. So here's our monthly rinse indicator bar at 65% of the rinse cycle, so it's still working the bleach solution through the machine and making sure to clean all the components. Once it's done flushing the bleach solution, it will do a regular flushing cycle just to get any of the bleach out, and so that's what it's doing now. And then once that's done, we can run our quality controls. Now that our monthly rinse has been done, I'm going to perform the quality control test on our CBC machine. This is just a quality control sample that's sent to us by IDEX that we run monthly after the rinsing and flushing, just to make sure that our CBC machine is functioning within normal parameters. So I'm going to get that started by following the directions. First I want to have it warm up at room temperature for 15 minutes, and then I will run the quality control. Now that my vial's been warming on the counter for its 15 minutes, I'm going to invert it just to make sure that all the cells in the quality control vial are well mixed. And then on our vet lab station, I'm going to go to Instruments, select our ProCite, go to Quality Control, and then add my QC lot by scanning in all 6 of the barcodes. And then once these are all scanned in, doesn't matter which order, as long as they all get in there, then we'll be ready to run the quality control. The next thing I need to do is change out the adapter in our ProCite machine so that we can fit our quality control vial in there, and then get that loaded in the machine, and then I will start the quality control running. Okay, Now that the ProSite is doing its quality control, it will run for a little bit and then it will give me a printout on our printer of our quality control results and whether or not they're in normal limits. These are my results for the QC, the quality control on our machine, and all of our parameters they're within normal limits, and that was our normal quality control test. So everything looks good and our machine is ready for use. I'm now going to set up and run a SNAP ELISA test. I have my 40x SNAP test. It's at room temperature. I have my whole blood patient sample here. So we do store our tests at room temperature for the 90 days maximum. So the test comes with its own dropper, and that measures the appropriate amount of sample. I also have my washing test solution here, so, and my sample container. I am going to put 4 drops of my solution, and then 3 drops of my test sample, using the pipette and making sure that both my bottle
Oncology, Lisa Scott is available. Please dial 334. Lisa Scott 334.
and the pipette are nice and vertical to deliver uniform drops. I'm now going to invert that tube 3 to 5 times just to make sure that the sample and the solution are nice and mixed together. And then on our test, there's a little well there, and that's where I'm going to pour the sample. And as I do that, the sample is going to run up into the test indicator window, washing out the indicator dots that are there. So once your sample is coming up and you start to see it in your little circle indicator window, that's time to snap it down. So I see the red change, so I'm going to press firmly, making sure that the test is fully snapped down on the sides, and that is when the solution within the test is going to start mixing in with your sample and your testing solution. And now you start the timer for 8 minutes, and that's when the test results are read. Now that our 8 minutes are up, we can view the test results. We have the 1 dot in the upper left corner indicating that's our control dot, and that indicates that the test is functioning properly. It does have the potential for 4 more dots. A dot in the top area, sort of in this area, would indicate anaplasmosis. Over to the left, kind of in the middle, would be for Ehrlichia. A dot at the bottom would be for Lyme, and a dot on the right would be our positive heartworm test. But Abby is negative for everything, and so I can document the results in her chart. I am now going to get an ear cytology sample from a dog. I have my patient. I have an otoscope just to take a look inside his ears. I have my frosted slide ready, some Q-tips, and a pencil for labeling the slide. So the first thing I'm going to do is just turn my otoscope on, just take a peek inside his ears. He's been scratching a little bit recently. It's got a mild amount of discharge. So to get the sample, I'm going to start with his left ear. I'm going to lift the pinna and insert the Q-tip into the vertical part of the ear canal and gently rub it against the wall of the canal. And then I'm going to put that on the left side of my slide. I'm going to then get my other Q-tip And repeat that with the right side, just gently inserting the Q-tip into the vertical canal, obtaining my sample, and rolling gently the sample onto the right side of my slide. It really doesn't have that much on there. So then I have each of my samples on the corresponding side of the slide, and I will label that left and right. And also with the patient name. And then I will move on to staining the slide and reading the sample. I'm now going to demonstrate the proper way to stain and prepare an ear cytology sample for reading. I have my slide. First I'm going to heat fix it by using a lighter and heating the underside of the slide. And what this does is this helps sort of affix the cells and set them into place. And then I'm going to wipe the soot off of the bottom of the slide gently. And I have my Diff Quick stain preparation. So the first one is our fixative. And I'm going to put the slide into that for 10 1-second dips. And this is our dirty slide preparation, so this is not something that we would use for our like a cytology for like a lymph node aspirate or something that we really wanted to look at, you know, cellularity, or so we have a separate stain container for that. So I'm now going to put the slide into the second stain jar and repeat that. My paper towel here to sort of get off any extra. And now into the third and final. And now I'm going to rinse the slide gently under a stream of water, letting the water touch sort of the edge of the slide so that it runs gently over the surface and it doesn't damage the sample at all. And then I will dry the bottom and sort of blot off any excess, and then let the slide air dry before I read it. Now that my ear cytology slide is stained, I'm going to evaluate it under a microscope. I have my slide, some immersion oil, and the first thing I'm going to do is use the coarse adjustment knob, lower the stage, set my slide onto the stage and secure it using the arm. Then I'm going to read it with my 100 power objective lens under oil, and I am going to look at both sides of the slide. This is special immersion oil for the lenses, well, just for the 100 power lens. And I am going to read both sides, but I'm going to start with the right side. And I'm going to lower the lens so it's in the oil. I'm going to turn my light on. and look through the oculars. And when looking through the oculars, I'm only going to adjust the fine adjustment knob until I see my sample very slowly. Because using the coarse adjustment knob can not only damage your objective lens, but it can break your slide as well. So I'm just going to keep going until I see my sample. Okay. I now see that there's quite a large amount of anucleated squamous epithelial cells. I'm going to take a look around the whole field. Just making really fine adjustments with the knob, the fine adjustment knob, to see the different sort of planes of the image, to make sure I'm not missing anything, and at least in this right ear I'm seeing quite a moderate amount of yeast, which would explain the itching. Not seen any bacteria yet. So now I'm going to lower my stage, switch back, to my lowest objective lens so I can put some oil on the left side and adjust it so the oil's under the 100 power objective lens, and then repeat the same thing with the sample for the left ear. There. Okay. There we go. Okay. Scan this for a little bit. Same thing. First thing I notice is large amount of squamous epithelial cells, anucleated. So. Left ear seems to have more yeast than his right ear. Also not seeing any bacteria on this side. bacteria, no white blood cells. Okay. So now I'm going to lower my stage, turn the light off, and I will clean the 100 power objective lens with lens paper and report these findings in the patient's medical record. This is a basic setup for a necropsy. We are in a private sort of isolation part of the hospital, away from other patients, and I have my form here verifying the patient signalment, the client's name, and also the authorization for the necropsy, and I have my necropsy instruments laid out. The next thing I'm going to do is put on my PPE and get the patient. The next thing I'm going to do once I have my patient is verify that I have the correct patient, that we have authorization. And so I'm going to examine the signalment on the body from the fridge and on our forms, and everything looks good, so we're going to start the procedure. So now we're ready to begin our procedure. We have our patient who is verified by another tag on her hind paw. I'm wearing my full PPE, my goggles, mask, gown, and gloves. And the first thing we're going to do is review her full signalment and medical history prior to presenting to the clinic. Mush is an 18-year-old female spayed, domestic short hair, and she presented DOA after sudden collapse at home. She has a history of chronic renal disease, and the client's concern was if there was a clot somewhere that led to the sudden collapse at home. So I'm going to write everything.
This is a necropsy of an elderly feline. For body condition, she is underweight and somewhat emaciated. She does have a shaved area on the inner left thigh. I do not see any bruising or any other damage to her. So due to the concern of a clot, we will open the abdomen along the midline. Just extending the incision in both directions. Entering into the abdominal cavity at this point, and extending the incision in both directions. Her spleen and liver have a mottled appearance, but appear to have a normal texture and appear to be a normal size. Her intestinal tract also appears to be normal, and there is feces throughout the intestinal tract. Her left kidney is considerably smaller than normal, an abnormal color and an abnormal texture. Her right kidney has a similar appearance. Through examination of the aorta and her femoral arteries, I do not find anything consistent with a clot. Given the abnormal appearance of the kidneys, I will take a sample to confirm for the client that renal disease was the cause of the animal's death. Thank you.
The first major consideration to take when handling rabies suspect bodies for necropsy is personal protection equipment, your PPE. All personnel in the area should be vaccinated for rabies when working with any rabies positive suspects. They should also wear full waterproof gowns with long sleeves and cuffs that extend all the way up to the wrist. The first set of gloves would be then put over those cuffs and followed by thicker rubber gloves over top of that. You also want to wear a face mask to avoid aspirating any potentially contaminated body fluids, and also a shield for your eyes or full goggles with side protection to avoid any splatter coming in contact with your ocular surfaces. Taking extra care, when handling any of the brain or, CSF, any fluids, and anything involving the spine, but definitely taking the precautions with the whole body. For large animals, you also, in addition, would want to wear waterproof pants as well as rubber boots, just so you can keep everything, as clean as possible. You can rinse off and avoid tracking any potentially contaminated material into other areas of the hospital. The specimens taken would be shipped on ice immediately to the lab for the fluorescent testing, and not on dry ice and never frozen. Any rabies suspect patients should be kept in the refrigerator if they can't be processed immediately. And then once the samples have been obtained, the remains of the body that aren't being sent to the lab should be put, ideally double bagged in a biohazard, a red biohazard bag, and sent out for biohazard waste disposal. I'm now going to get a canine vaginal cytology. I have my swabs, my slide, and my patient. So I'm going to start by swab ready, try and part the folds, enter kind of at a little bit of an extreme angle, and then even out, inserting the swab and gently rolling. Collect my sample, and then I will gently roll that onto the slide, and then prepare that with my Diff Quick Stain. I'm now going to stain my vaginal cytology slide. I have a Diff Quick Stain here. The first thing I'm going to do is fix my slide, and this will just fix the cells, the sample to the slide. Next step, let's start with the stain, the first stain. Now a gentle rinse. On the side of the slide, just so it breaks up the stream a little bit. I have the sample angled downward a little bit so the water's not hitting directly on the sample. And then I will wipe off the bottom of my slide and blot the edges. And then the rest of my slide I will let air dry now that it's stained, and then once it's dry it will be ready for evaluation. Now that my slide is stained, I'm going to analyze it. So I have my slide on the stage, and this I'm going to read under high power. Got my immersion oil, so I'll look at it with the 100 objective lens. So I'm going to switch to my appropriate lens. Drop it down, look through my objectives. Use the fine adjustment knob until I see the sample. Okay. All right. I'm seeing some intermediate cells. I'm not seeing any blood or neutrophils, and I'm not seeing any cornified cells, which would indicate estrus. The blood would be proestrus, and then neutrophils are usually seen in diestrus, but I am just seeing a moderate amount of paravasal cells. With no blood, no superficial cells. So this patient is currently in anestrus. And just want to look at the whole field just to make sure. Nope, not seeing anything different. So this patient is currently in anestrus. I am now going to do my major and minor cross-matching. I have the blood and serum from both my recipient and my donor, and the first thing I'm going to do is centrifuge the whole blood. So I'm now going to spin my whole blood for my donor and my recipient. I'm going to load them into the centrifuge. On balanced parts of the rack, I have the RPM set appropriately. I'm going to close the centrifuge and spin it for 10 minutes. I'm now going to draw the plasma off of the top. Of both my donor tube and my recipient tube. Making sure to use a different pipette for each tube. The next step in my cross matches, I'm going to wash the erythrocytes of both the donor and the recipient with 0.9% sodium chloride. So I'm going to start with my donor. I have both my tubes labeled, and I'm going to take 2 drops of my red cells my tube. And then I'm going to fill the rest of the tube with saline. And this is the 0.9% sodium chloride. And now I will gently mix the tube. I have to draw some air off. Gently mix the tube, and then I will repeat that with the recipient blood, and then they will need to be centrifuged again. So I'm now going to centrifuge my blood with the saline for a minute. I have it set on 330 or 3,300 RPMs. I'm going to set the timer for a minute. My red cells have been washed once. This is my recipient. I'm just going to remove the saline from the top. And then repeat the process with the saline and recentrifuge. And then I will do that with my donor sample as well. I'm now loading up my donor and recipient samples for their second wash. And I'm going to repeat the process I used the first time. And during the whole cross-matching process, I'm keeping my recipient blood well labeled, as well as my donor blood, and keeping them separate from one another, just so no contamination occurs between samples before I run the cross-match. To do my third wash on my erythrocytes, I decanted the saline and then added more on, and I'm going to gently mix it again before recentrifuging for another minute. So now my cells have been washed 3 times. The supernatant is nice and clear, colorless, and so I'm going to decant off everything on the top, leaving my washed, packed red blood cells at the bottom. I'm now going to begin my cross match. I'm going to start with my major cross match. I have my tube labeled for that, and I'm going to take 2 drops of my recipient serum and mix that with 2 drops of my donor's cell suspension, and I have my 4 pipettes for the different things that I'm going to be using. So my first, I'm going to use my recipient serum pipette. I'm going to get 2 drops of the serum. Holding the pipette vertically to make sure I get nice even drops. And then I have my donor cell suspension, and use the donor cell pipette. Two drops in. Gently invert, and then it's my major cross match. I'll let that sit. I'm now going to do my minor cross match. So I have my tube labeled for my minor cross match. I'm going to put 2 drops of my donor serum in. and then 2 drops of my recipient cell suspension. Place the cap back on, gently mix, and then let that sit. And next I'll be doing the controls, and I will be running 2 controls. One is going to be our donor control, and the other is going to be our recipient control, and these are going to consist of mixing 2 drops of the recipient's serum with the recipient's cell suspension, and then the donor serum with the donor cell suspension. So I have both of my recipient tubes here, and I'll be putting 2 drops of each into my recipient control tube. All of them are labeled, and I'm going to use the pipettes that I have pre-labeled also for my recipient serum, so that I'm not, once again, cross-contaminating anything. So this will be my recipient control. And then I will repeat the same steps for my donor control. Now that my tubes are all mixed, and as you can see they're labeled, major, minor, donor control, and recipient control. I'm going to set my timer for 30 minutes and have them incubate at room temperature before completing my cross match. Okay, so my timer is just now finishing, and so I'm going to take my 4 tubes over to my centrifuge and load them up and spin them down for a minute. I now have my tubes in the centrifuge, and I'm going to spin them for 1 minute. Now that my tubes have been centrifuged, I'm going to examine each one first for hemolysis. So that's my donor control. There's no hemolysis there. This is my major cross-match. I'm not seeing any hemolysis on that one either. And my recipient control also looks good, no hemolysis. And then my minor cross match also looks good. I'm then going to just tap them gently and check for agglutination of the erythrocytes. So this is my major cross match. I'm just going to resuspend the erythrocytes and check for agglutination. And I'm not seeing any. Everything looks evenly dispersed. Check my minor cross match. And that looks good as well. As do both of my controls. So I'm going to have to examine under a microscope just to make sure there's no agglutination that I can see on a microscopic level. I'm now going to examine each of my samples for microscopic agglutination. I did not see any macroscopic or any hemolysis on the serum. I have 4 slides here and my samples as well. The slides are labeled for the appropriate tubes. I'm going to start with my major cross match. I'm going to get just a small drop and place it onto the slide. And then set it onto the stage. Turn my light on. I am going to lower the condenser for this. Looking at it on low power, just looking for clumping. of my erythrocytes. Which I'm not seeing. They're all nicely, evenly dispersed throughout the suspension. There's no clumps that I can see. I'm going to look over the whole field. Everything looks great. Drop the stage down. And then take a look at my minor cross match as well. Making sure to use different, have my different syringes for each tube and slide, so I'm not accidentally mixing anything. And I'm seeing my condenser a little bit more. I'm seeing the same on this slide, nice, even, evenly dispersed erythrocytes through the whole suspension. So that looks, everything looks good. And I will repeat the microscopic evaluation of both the donor control and the recipient control, just to be thorough and make sure that everything looks good across the board before declaring that these two are compatible matches for blood transfusion. I'm now going to demonstrate a skin scraping on a patient. I have my mineral oil slide, cover slip, and a number 10 blade. I've put a drop of mineral oil onto my slide, and I'm going to take my blade and touch it in the mineral oil, but also run it along the glass to dull the blade prior to my skin scraping. I'm then going to find one of the areas of concern, which is this crusty lesion here. Go to the edge of the lesion, and while pinching the skin, run my blade in the direction of the hair. Making sure to get a good sample and stopping when I start to see a little bit of blood, showing that I got well into the desired layer of analysis, and then going to transfer my sample back to the slide, place my cover slip, and then it is ready to read. Now that I have my skin scraping sample, it's ready to be evaluated. I'm going to set my slide on the stage of the microscope and secure it into place. Turn my light on. The skin scraping I'm going to read with the 40 power objective lens. And some things I'm looking for with the skin scrape, the most common thing that we would see is Demodex. That's probably the easiest mite to find on a skin scraping analysis. For the deeper scraping like I did, where you actually get break in the capillaries. You can find Sarcoptes, and also lice can be seen on skin scrapings, but Sarcoptes and lice are not as easy to get a good sample. So I'm just going to scan the whole field of the sample, and even just one egg or one mite would be diagnostically positive for that organism. And I am not seeing anything, which is good. So but if I were to see something, either the lice or a type of mite, I would observe the shape and the size and everything, and also sort of its characteristics, its color and everything, to determine what species it was from, so that I could let the veterinarian know and get an accurate diagnosis, so we could start the appropriate treatment for the organism that's seen.